everybody. Welcome back to the show. Hope you're all enjoying a great summer wherever you are. Thanks once again for joining me. Today, I'm looking at a very important question that isn't being dealt with in a serious way in the mainstream media space. Whatever you may think of COVID-19 restrictions, such as mask mandates, vaccine mandates, and lockdowns in particular, the defenders of these public health measures claim that they were a necessary tool to combat the pandemic. But those defenders often neglect, whether willfully or not, the costly and damaging negative effects these public health measures had on us. And those negative effects, if they're large enough, could even outweigh the benefits. The point is, we won't know until we look at both sides of the ledger and not pretend that lockdowns had only a good side to them. This is to say nothing of the fact that several of these policies themselves had a dubious rationale at best in some cases. For example, as many of you know, on August 2nd, I broke a big story for Common Sense that the federal vaccine mandate for travel had no compelling scientific rationale. And whatever scientific rationale there was, how is it that it applied to Canadians and everybody else, except not to unvaccinated Ukrainians arriving in Canada after the war? I understand why Canada might want to be compassionate towards those fleeing a war zone, but it's hard to believe that the virus understood this difference. And then again, where was the compassion to the millions of Canadians who couldn't travel to meet their loved ones and were essentially prisoners as soon as the federal vaccine mandates came into effect? Let's also remind ourselves that these mandates haven't been trashed, they've only been suspended and can be brought back in at the drop of a hat. Today's guest is ideally situated to talk about the harmful effects of COVID-19 vaccine policies that both federal and provincial governments are happy to sweep under the rug. Kevin Bardosh is an applied medical anthropologist and implementation scientist focused on using social science and community engagement to improve public health delivery and policy. He's affiliate assistant professor at the University of Washington. He was a lead author in an academic paper in British medical journal Global Health. It's a peer-reviewed scientific journal, and the study is titled The Unintended Consequences of COVID-19 Vaccine Policy: Why Mandates, Passports, and Restrictions May Cause More Harm Than Good. The title of the paper pretty much gives us a sense of where Kevin and co-authors come down on the issue. So without any further delay, let's get started. All right, so Kevin, welcome to the show. I was hoping that we could chat about this very important paper that you and your co-authors published in the British medical journal Global Health. You argue in the paper that contrary to the policy boosters who always point to the upsides of vaccine mandates, passports, lockdowns, etc., you point to what you call the, quote, counterproductive and damaging effects on public health of COVID-19 vaccine policies, in particular, which you say not only infringe on civil liberties, but can result in societal polarization and worsen mistrust in government, among other things. Could you tell me what led you and your co-authors to do this research in the first place? Did you see the need to have a corrective to the official narrative that focuses almost exclusively on the upsides of COVID-19 policies, and I would argue that it pays short shrift to its harmful effects?
Absolutely. I think there were lots of different motivations, and I can't speak for all of my co-authors. But from my side, on the one hand, it was just seeing a lack of debate about this issue. And when I say that, I mean, if you think back to pre-pandemic 2019, if you were to gather a bunch of global health experts together and give them a scenario, which was what took place in 2020 and 2021, most of them would probably not advise the mandates and the lockdown approaches that we ended up taking, because they were not seen as standard acceptable policy response. Once we went down that road of locking down with China, Italy, and the US, it became very difficult for political leaders to step back and say, no, we're not going to do that. We're going to do something different. You had policy lock-in around lockdowns. So on the one hand, we just saw a lack of critical debate. People were also they might have had skeptical views, but they felt unable to come forward and express those because of reputational damage, etc. So we felt like a responsibility to articulate that in a scholarly way and in a way that would challenge people and offer a space to critically evaluate these mandates and the sort of policy culture around them. Also, secondly, just in my own social network, seeing people kind of freaking out in different ways, experiencing the mandates in polar opposite ways. So people saying, I'm not going to go around unvaccinated people. You're not welcome to come to my Christmas party, even though I'm a Christian, for example. And then other people ending up in psych wards because they were so negatively impacted by this sort of inspection of the motivation of what was taking place, right? And I'm reticent to use the word conspiracy theories there, but alternative power theories around why governments would mandate a product like that at that time and in that particular way, given concerns that predate the pandemic about the direction of government and this sort of increase of bureaucratic sort of culture around health and around just general service delivery. So I've seen it in my own social network, the negative impacts, and I think we've also seen it in Canada. And the irony is, this paper was written before the Freedom Convoy started. So clearly, we were feeling the social pulse of the time in Canada, but then also elsewhere. As you know, these protests were global in scope. They were covered in a very specific framing in the media, which I disagree with, and I think you do as well. So just trying to add nuance. I think one thing here is in this perpetual cycle of the death, what I call the death of nuance. So we were hoping to add to that debate, and I think we've succeeded in some degree.
I think so, because you marshal a lot of data and facts, and you point to, you cite lots of studies to support your study. I'm always intrigued. How is it that everybody just was, there was so little dissent, especially from the media, or from our, and anybody who dissented, I think any scientist, a doctor, epidemiologist who said, hey, wait a minute, this is not making any sense. I think we're going in the wrong direction here when it comes to school closures, when it comes to things like vaccine mandates. And anybody who said that was, shouted out of the room, was seen as was smeared and called a conspiracy theorist. Not a real doctor, and it was incredibly damaging, I think, and in a sense created this culture of fear that a lot of us, and I've explained this in a recent National Post column, I consider myself to be fairly rational-minded, and I'm not someone who's prone to hysteria and panic, but I have to say that at some level, some of that fear even got to me, and I remember searching for anything at that time. Is there anybody who says who's pointing to the opposite and saying, these intuitively I knew that these policies were very damaging. It made no sense to me why you would cordon off park benches. It just or where the top doctor in my city of Ottawa said that no more than 20 people could be on a hiking trail in the middle of winter. And we were told outdoors is one of the safest places you can be. But outdoors also became an issue. You couldn't be outdoors. So essentially, our movements were being restricted, and I'm very grateful for your contribution, you and your co-authors, for coming out with this, because now hopefully more people are starting to realize the damaging effects of these policies and starting to question, because we are not quite done. There's no guarantee that these policies are not going to return, right? I mean, we at least here in Canada with the vaccine mandates, even though they've been suspended for now, they could be brought back at the drop of a hat, and so there's no guarantee. And I hope that more people look at the study and look at the harmful effects these policies have had on us, and whether it was all worth it in the end. Do you think that these policies were worth it in the end?
So it's really difficult to make general statements, obviously, right? We're dealing with, my own work crosses lots of different countries. different social groups, etc. So I'm somewhat reticent to make general claims, but I would say on the whole, I think that we took a wrong approach here. And just to focus on the fear as an example, right?
Yeah.
Fear is incredibly stressful. It has all sorts of psychosocial and physiological effects. And when you ramp up fear for so long, which the media did, I mean, looking just at the journalistic stories, there was a study looking at journalism in the US that found like 90+% of media coverage was negative versus European countries where it was like 40 or 50%. So just the tone of media has a huge effect on the national psyche. I do think that a lot of the policies that we implemented will be found and are currently seen, should be seen as causing more societal harm than benefit. School closures are one of them. Like you said, outdoor mandates, right? In Ontario, from April to June of 2021, you had stay-at-home orders, right? Which were effectively limiting the ability to go outside and gather. And that was over a year into the pandemic. And I actually just finished a scoping review of the evidence on mental health in Canada for the pandemic. And it's really quite striking. I mean, there's no study that's saying, oh yeah, people are okay. All of the studies unanimously say mental health of people suffered drastically, anxiety, depression, psychiatric conditions, and they also increased over time. So by the time you get into 2021, they're worse than when they were in May of 2020, right? So was it reasonable to be locking people down when you were already vaccinating the most vulnerable population group?
It's very puzzling because, I mean, this is a question that I wanted to ask you, and I asked this to everybody, any expert. Why is it that we panicked so much we panicked so much after vaccination was widespread, and the variants were becoming milder and milder? What explains that panic?
No, that's a fascinating question that I have, scrawly notes everywhere about different thoughts. Yeah. And I think my conclusion would be, on the one hand, when you start with a fear-based message, it's really hard to backtrack, right? I mean, we heard very little empowering messages. We also had what I call a COVIDization of the world. Everything was seen through the prism of COVID cases, COVID deaths, fear of COVID, the new social norms around social distancing and physical distancing, or whatever you want to call it. And we became hyper obsessed with that. And the best sort of analog that I like to draw on is the 9/11 attacks. And I happened to have moved from Montreal to Boston a few months right before 9/11. And so I witnessed that as a Canadian in a foreign country. And I was astounded at how the Americans, the national psyche became completely overwhelmed with this vision of we need retaliation. And the narrative was very narrow. In fact, Howard Zinn, the famous leftist progressive historian, came to my high school a few weeks after, and his message was, questioning the government's response to this is not anti-American, right? That was the flavor. And if you remember, New York Times, everyone was saying, they were doing the drum beat to war. And people like Chris Hedges were completely marginalized for their skepticism about the war. And it took many years for the national conversation to admit, hey, this is a wrong decision. We had just war theory that emerged out of the ethics departments, similar to the ethical discussion around mandates. I think there's parallels between that. And then lastly, the great irony, or the tragic irony, is that the Afghan pullout debacle was occurring as the pandemic was still rolling on. We saw this sort of very stark reminder of the power of empire, or the weakness of empire being shown in the frivolity of it, as we're still arguing about masking 5-year-olds in New York City, let's say. I just think there's a lot of parallels there.
Absolutely.
And so the second concept is this notion of Safetyism, which the moral psychologist Jonathan Haidt has talked a lot about, which has been in the last 20 years, as we've become a culture of affluence. We put safety as the sort of highest moral value, a virtue in and of itself. So everything's about making sure everyone is safe. And I think what we've seen here is that there is a risk to that perpetual obsession with safety, and a miscalculation of risk also. So like for myself, I was very alarmed at what was going on in China very early on. I knew about this, as the first sort of whispers were occurring. My kids were masked in January. We were, disinfecting our groceries in January before anybody was doing anything. And then as I learned about the age distribution and thinking, okay, we're healthy people, our risk profile completely dropped off sort of like May 2020. And also, anyhow, I won't get into all the nuances of our family situation, but I think that was an appropriate response for my particular age group and the way that I interact with people in society. So,
so there was this one size fits all approach to everybody, right? So we knew right from the get-go that that the most vulnerable had to be protected. So people in long-term care homes, retirement homes, the elderly, those who are immunocompromised. But why would, say, a teenager, someone in their 20s or the 30s or even 40s for that matter, very healthy, why is it that we were also subject to the same measures? And that is something that I didn't understand as well, very early on. And as you say, I made my own risk assessment. I possibly had COVID very early on back in January 2020. And then I was triple vaccinated and then I got Omicron. And then I still, was worried that I was unmasked in a crowded space. And I was thinking to myself, well, where's the science here? The science says that I have all of these antibodies, and what am I so afraid of? And it just made no sense. And at that point, I think everybody comes to this decision in their, at their own pace. And for me, it took a while. I had ups and downs, but I came to the same conclusion. That's it. I'm done being fearful, and I just want to move on with my life. And whatever happens, and I'm, I accept that responsibility. But so far so good is all I can say. But going back to your paper, Kevin. So in your paper you break down the potential unintended harmful consequences of COVID-19 policies into four categories, which you describe as: one, behavioral psychology, political and legal effects, socioeconomics, and integrity of science and public health. Would you like to tell me how you narrowed down your analysis to these four areas, and why you believe these are key to understanding the harmful effects of mandates or other public health measures?
Yeah, I mean, as a applied medical anthropologist, we use in thematic analysis. We try to make sense of the complexity of social life by grouping things into major themes. So that's effectively what we did here. Just looking at the literature, so doing a literature review, and then reading basically as much as we could about this particular topic in different countries. And then also, I think Twitter was also a fabulous resource just to understand people's responses and their opinions about this particular topic. And it's pretty standard also. If you think about the effects of a policy intervention, these are pretty standard areas that you would talk about. So that's how we determined the structure of it.
So and your paper also has these incredible quotes from major world leaders, including our own Justin Trudeau. And I urge everybody to take a look at this table 2 of the paper. These are major world leaders who are essentially scapegoating and stigmatizing their own people who happen to be unvaccinated. Macron, for example, in France says he wanted to piss off the small minority of the unvaccinated even more than before, and went so far as to claim that someone irresponsible, in his opinion, is not even a citizen. And of course, we know what our Prime Minister Justin Trudeau, when he infamously said he tarred all of the unvaccinated as a group of misogynists and racists, asking, "Do we tolerate these people?" I mean, this feels like it's right out of the 1930s. So thank you for assembling these incredibly disturbing quotes in one place. But why do you think that these world leaders made these outrageous claims to marginalize and stigmatize their own citizens? Do you think they genuinely believe this, or was this a political tactic to perhaps increase their power and authority, or in this case, in Canada's case, serve as a wedge issue, as I recently argued in the case of Trudeau's federal vaccine mandate for travel, which was conveniently announced 2 days before last fall's election.
Yeah, it was great questions. So on the one hand, it depends on what the information that they had available at the time was, right?
Mm-hmm.
I mean, if you thought that the vaccine would actually end the pandemic, which is what we were told, right? If you go back to mid 2021, that was the rhetoric.
Mm-hmm.
This is 97% effective, and we are going to end the pandemic if everyone gets vaccinated. It's clearly was not true. It was obvious at the time. If you were somebody who specialized in vaccinations and global health, you could understand that this was going to be probably a non-durable vaccine. There was data out of Israel and the UK in early to mid 2021 showing that the vaccines were not durable in the sense that they would stop transmission completely, et cetera. So it depends on what their scientific advice was. I would also say that there's just this sort of very narrow view of vaccination as a totem, as something that's morally good and can't be questioned. It's sort of a standard notion that vaccines are always safe no matter what, and everyone should get vaccinated. What's your problem? Why aren't you vaccinated? So it's seen as it's almost like intelligence test. And I would argue that that's also a fallacious concept. It erodes people's individual decision-making agency. So, I mean, one astounding thing about all of this is the sort of complete denial of prior infection. And in fact, if you go back and there were papers pre-vaccine talking about the ethics of immunity passports. So if somebody had COVID, should they be given freedoms that the rest of us don't have because they have this prior infection sort of immunity? And that was seen as a bad idea because it would promote people to go and get infected. So I think that was also part of this logic was, well, if we allow prior infection to be given equal status, people who don't want to get vaccinated are all going to go get infected at these COVID parties. So you can see again this sort of parental or very kind of condescending perspective of our government on citizens. Like, you can't make decisions for yourself, so we're going to tell you what you need to do.
Very paternalistic. Exactly. But in a sense, what has ended up happening now with the current approach is that with vaccination, essentially all of these countries are like, I think at this point you might as well get infected.
Most people have already.
Yeah, and so exactly. And why do you think that they downplayed something as old as time itself, which is natural immunity? Why is it that they doubled down on vaccination in such a big way and just completely ignored the fact that you could recover from COVID-19 and you had these antibodies, and now you have studies coming out saying that these antibodies are in some way, in some cases, just as good as getting vaccinated. And if you're vaccinated and recovered, that's even better, perhaps. I don't know, but the point is that there's a slow recognition happening right now that natural immunity does play a role. But why did we initially just ignore it? What do you think happened there?
So I think there's the scientific data about the vaccine, and we need to give people the benefit of the doubt, or be a little bit not compassionate, but understanding, in the sense that this was a very stressful emergency. A lot of people died from COVID. A lot of people suffered because of the consequences and the restrictions. And I do think I don't want to just create this increased polarization of the conversation. But there's also a need to take stock of what happened so that it doesn't happen again. If you go and read Bill Gates's recent book on pandemics, he basically lays out this plan that if there's another respiratory pandemic or whatever, we need to lock down for 6 months while the pharmaceutical companies and the government creates a vaccine.
Amazing.
And then we can open up again. So this idea, this is going to be now in the rule book going forward. And that really needs to be questioned, in my opinion. So what data were they looking at? Second of all would be, just I just lost my train of thought for the second. Oh, right. This increase of bureaucratization. So a vaccine is something that you can standardize in the sense of, okay, how many people are vaccinated? 60, 70%, blah, blah, blah. You can easily sort of monitor it. You can easily track it. So I think that that's one of the things, whereas prior infection, it's almost like a natural thing. It's unruly. How do we know if somebody was really infected at what time? What antibody level do they have? There was all this conversation about this. So I would say that on one hand, it reflects this bureaucratic culture in government. On this third kind of thing, and to be controversial here, but this is an obvious thing. The pharmaceutical industry made a huge amount of money, $100 billion. I mean, this is the same pharmaceutical industry that pre-pandemic, a lot of people who were very forceful about the mandates would be skeptical, saying, look at the crisis, look at mental health conditions where we just drug everyone up with Prozac. Oh, the pharmaceutical industry, is manipulating the trial data. And yet when a pandemic happens, no, you can't question the pharmaceutical industry. And yet the revolving door between government and pharmaceutical industry is actually increasing with time. It's not decreasing. And, for example, the Freedom of Information Act that this NGO in the US, initiated, Pfizer and the FDA tried to stop it and tried to basically argue that it would take them 75 years to release all of the internal communications between Pfizer and the FDA. So take off your preconceptions about the pandemic and just put on that hat for a second. I think that needs to be looked at a lot more carefully. This whole notion of 97% effective at transmission, it seems like we were also very, very hopeful. People were hoping that this would stop. It would be this sort of, okay, now we can go back to normal, everyone's vaccinated. So there was this massive sort of social hope that unfortunately didn't quite pan out in the way that it did.
Yeah, so that was that leads to my next question perfectly, which is one of the points you make in the paper, which I thought was very striking and salient, was the lack of transparency about the vaccines themselves. For example, pharmaceutical companies and governments haven't released all of the relevant data. It fosters suspicions and fuels conspiracy theories, which could be easily diffused if the data were simply made public, I think. And forgive me for being cynical here, but I feel like one obvious reason for not releasing such data is that it doesn't support the idea that the vaccines were the greatest thing since sliced bread. And as we've seen, governments around the world, including Canada, they keep watering down the claims. And this is a point that you make in the paper as well. Originally, we were told getting double jab would be the route to return to normalcy. Then we were told getting a booster would reduce the seriousness of symptoms, and even though vaccination was supposed to prevent you from getting infected. Now we're told it's to help our collapsing healthcare system, which was already collapsing even before the pandemic.
Right.
And you
especially in elderly homes. Right?
Exactly. These are not new issues. But what do you make of this constantly shifting goalposts, and how does it affect the future of public health policy, especially in Canada? Will people trust the government going forward if they say you must do X, Y, Z in the interest of public health and your own public safety, when the promises of these mandates, of these COVID-19 restrictions have run hollow on so many occasions?
Yeah. So two things. One is, in the paper, we make the argument that when you mandate a vaccine, you should be held to a higher standard of transparency than if you don't mandate it. So if the vaccine efficacy is not as effective over time, if you didn't mandate it, you're going to maintain population trust more than if you mandate a vaccine and it doesn't turn out quite in the way that you were saying it, which is what kind of is taking place or has taken place here. Number two is, it really depends on whether the population, the citizens of a country, really care, right? Like, how many Canadians still think that lockdowns were a wonderful intervention that was necessary? How many of them think that vaccine mandates were absolutely necessary and think that, people who were protesting against them were sort of far right, Trump conspirators that are related to QAnon? The data, there's not a lot of data out there to suggest. I think that it's certainly shifted over time. There's a lot less people that are supportive of that as they become infected themselves and sort of experience different things in their own social networks. But I think that we are going to see we already have seen a massive backlash against trust in public health and in government
Mm-hmm.
because of the way that this has been handled. And for example, there's no, to my knowledge, there is no cost benefit of analysis of boosters for people under 40 from the
Mm-hmm.
US with Omicron or even Delta going forward. So the US CDC and FDA and whatnot are advocating for, 10-year-olds, 20-year-olds, 30-year-olds, 39-year-olds to get boosted, but they don't actually have like an age-based harm benefit
Mm-hmm.
analysis for that age group. And so another paper that we have hopefully coming out soon, we offer the first risk benefit analysis in that group.
Okay.
I won't get into the results, but then we pivot and we make 5 ethical arguments against booster mandates.
Mm-hmm.
Some of those include, like, if you don't have a clear benefit, you shouldn't mandate a vaccine, right? So like there's a trustworthiness issue there. You're damaging trust in regulators and in public health authorities if it's not clear.
Yeah.
Second of all, if you don't have a vaccine injury compensation program that is functional, and that's the case in the US, and I would say even in Canada, these people, on rare cases, sure, I'll use the word rare, people have been injured from the vaccine. We acknowledge that in
Yeah.
public health, that all vaccines have some side effects. And those people have not been compensated. And they've actually had horrible experiences, many of them, through the bureaucratic Byzantine maze of seeking compensation. So if you don't have a functioning compensation thing, you're asking people mandating people to participate in something, and you're not providing compensation, that's unethical. And then we look at also for under 40, a lot of schools and universities are mandating boosters. So individuals who have prior infection, maybe they're concerned about myocarditis, whatever they have, humans are complicated. We have all sorts of reasons why we do something and don't do it. You're effectively taking away their ability to go to school, to keep a job, etc. And this late in the game, it doesn't really make sense when so many people have already been infected. It's quite surprising to me that booster mandates are still on the table at this point.
Yeah, but do you see a shift happening at all anywhere, whether it's in the US or Canada, a shift from our public health officials, a recognition that, public trust has been lost to some extent, to a large extent, and that, hey, maybe we need to step back a little bit and rethink this, and not have this top-down technocratic approach to public health. And do you see that happening at all?
I mean, absolutely, it's happening. It's been happening
Yeah.
for over a year now. I think when people felt like they could voice dissent and not
Yeah.
be classified as deviants that were, killing grandma or whatnot.
Mm-hmm.
I don't know where we go from here. It's hard for me to get a sense of the pulse of my colleagues that are outside of the skeptical frame that I am very much in.
Mm-hmm.
And I am concerned. And I think as a social scientist, I'm interested to stay close to what research data is showing. And I am open-minded. I'm not dogmatic, or I'm not an ideologue here. But there's going to need to be a pivot. And to go back to the 9/11 example, right?
Yeah.
How long did that take for the foreign policy establishment in the United States to shift their narrative around foreign interventions in Afghanistan, Iraq, North Africa, et cetera? I mean, it took decades, and even now we're still dealing with the debt from those decisions and the loss of government trust. I mean, 9/11 and the wars in the Middle East were predicated on phony information, phony intelligence in many, and they had devastating consequences for people's lives.
Yeah.
So again, I think that this is going to be a process, and I think I see it as part of my role is to just push people and say, hey, look, was this really a good decision? Was this really the way that we want to do things? And look at the consequences.
Yeah. Do you think that do you envision at some point some of these measures coming back, maybe sometime in the fall? Do you think that's going to happen, or do you think that we're basically done with lockdowns and mandates?
I don't know. I mean, COVID is, it's not a nice virus. It can be quite devastating for people, and we're going to be getting it, going forward into the future. And so I'm not an expert in the long COVID literature. I am concerned about it. And it's going to be a difficult balance of what we do going forward. And I don't have any
Yeah.
I haven't spent the time to sort of put my head together and really think about what policies we should implement going forward. But it does seem like most school districts are,
Yeah.
they're advocating against mask mandates, against
Okay.
closures. Even in Massachusetts recently,
Mm-hmm.
which was, had very
Mm-hmm.
maximalist approaches for a while. The
Mm-hmm.
CDC's new guidelines are certainly a step in the right direction. But then we're going to face a situation where if we just have nothing, we have no control, right?
Mm-hmm. Mm-hmm.
Then we need to sort of flip the narrative and say, okay, how can we support reductions of COVID mortality and morbidity?
Yeah.
Right? We don't want to just allow people to sort of suffer and die from a virus if we can prevent it.
Mm-hmm.
So I think we're going to have a rethink, and obviously ventilation plays a good role there.
Okay.
Paid sick leave, a great idea.
Yeah.
Early treatment with anti-inflammatories, etc., and hope. Right? That's
Mm-hmm.
one of the
Mm-hmm.
most perplexing things about this whole pandemic is we were
Yeah.
told, shut yourself in your house, don't go and gather with people, and if you get sick, stay home, don't do anything until you can't breathe, and then go to the emergency room. I
Mm-hmm.
mean, what kind of health policy is that? I mean, even so, I say that sometimes I think, like with the whole ivermectin debate, even if ivermectin is completely not effective, there's still a placebo effect involved, and right, of doctors saying, no, we've got something that can help you. So I mean, yeah.
Yeah, no, it's been, I think I will look back on this time. I mean, I think we're already kind of doing that, just how ridiculous some of these discussions were. And how many of us went along with it, but at least I think some of us are waking up, and that's a good sign. But hey, Kevin, that brings us to the end of this discussion. But it was great having you on the show. Of course, we're just scratching the surface here. So I hope you'll be back on the show again soon, but hopefully not to discuss the next set of mandates that come down from the government. So I really appreciate you taking the time to chat with me, and also to you and your colleagues for I think writing, coming up with this study, which is a very important corrective to the official narrative that lockdowns were amazing for all of us, and they did all of these great things. So thanks for being on the show, Kevin.
My pleasure. Thanks for having me.
Okay, thank you.